Alright, today we'll be going over an overview of SGLT2 inhibitors and their use in heart failure. Specifically, we'll be looking at the differences in indication and outcomes between the three different SGLT2 inhibitors on the market. Very exciting stuff, and also an area that's changing very rapidly, so expect much of this information to become outdated relatively quickly. Let's start off by going over a brief background and timeline of SGLT2 inhibitors in heart failure. So, as mentioned, there are currently three different SGLT2 inhibitors available: Invokana, Farxiga, and Jardiance. All three were originally approved in 2013 and 2014 to improve glycemic control in adults with type 2 diabetes, which is what they're most known for. After they became commercially available, though, we started getting more and more data on their benefits in other areas as well, including heart failure. This would eventually lead to each SGLT2 inhibitor getting a new indication for heart failure. Invokana was first approved in 2019 for heart failure in patients with both type 2 diabetes and diabetic kidney disease to reduce the risk of cardiovascular hospitalization. This was quickly followed by Farxiga, which gained an indication for heart failure again in patients with type 2 diabetes and to reduce hospitalizations as well. Now, till this point, we were still looking at patients with type 2 diabetes and seeing if SGLT2 inhibitors could benefit other comorbidities in these patients. This changed in 2020 though, when Farxiga was approved for heart failure with reduced ejection fraction, or HFrEF for short, to reduce the risk of cardiovascular death and hospitalization, whether the patient had type 2 diabetes or not, demonstrating that SGLT2 inhibitors could be useful in heart failure independent of diabetes. And then finally, Jardiance was also approved for HFrEF to reduce the risk of cardiovascular death and hospitalization in 2021, which was then expanded in 2022 to include all heart failure patients, regardless of ejection fraction. So we can see that each SGLT2 inhibitor is indicated for a slightly different heart failure population, which is summarized here. We can also see how the indications have broadened over time, with Invokana being approved for a very specific segment of the heart failure population, while Farxiga and Jardiance are approved for a more broader and broader population. Moving on, in terms of effectiveness, the three SGLT2 inhibitors are fairly similar in reducing hospitalizations versus placebo in their studied populations, as you can see here. Roughly a 30% risk reduction from placebo, with a comparable reduction for urgent care and emergency room visits for heart failure as well. Jardiance, in particular, was the only SGLT2 inhibitor to show this effectiveness in heart failure with preserved ejection fraction, or HFpEF. But if we take a look at the subgroup analysis from the Emperor Preserved trial that this data is from, we can see that the statistical significance was primarily driven by patients with an ejection fraction that the American Heart Association classifies as mildly reduced, from 41 to 49%. And as you can see, the subgroups in the trial with HFpEF experienced a decreased magnitude of benefit the higher their ejection fraction. From this, we might be able to see that your patients with HFpEF might not see the same level of benefit as observed in the literature. Moving on to mortality, while all SGLT2 inhibitors showed a trend towards benefit, only Farxiga showed a statistically significant benefit, and only in HFrEF, although both Farxiga and Jardiance did end up getting an FDA-approved indication for reducing mortality in heart failure patients. So as you can see, the benefit of SGLT2 inhibitors lies more in improving morbidity over mortality, at least based on current data. To summarize, this chart here covers what we just went over, also with some additional information regarding dosing. Now, at first glance, Jardiance appears to be the easy choice among the three SGLT2 inhibitors. After all, it has the broadest indication, indicated for both HFrEF and HFpEF, while not being restricted to only patients with a diabetes comorbidity. However, the narrow indications for Invokana and Farxiga are more indicative of their restrictive inclusion criteria in the trials in which they were studied and lack of data in other populations. In the future, it's likely that we'll see the indications for Invokana and Farxiga expand like Jardiance. Newer phase 3 trials such as DELIVER, investigating patients with HFpEF, will provide more data on SGLT2 inhibitors and heart failure, and this is very likely recommendations will change again as a result, likely with Invokana and Farxiga seeing their indications being broadened to include more heart failure patients. Definitely keep tabs on this class of medications and definitely expect to hear more about these in the future. That concludes my overview. Thanks for listening.